Hello, my loves. Hello, dearies. How are you? How are we? I hope you're all doing wonderfully well. My name is Salase. I'm a registered nurse here in Ghana, and you're so welcome to my channel. In today's video, we are going to talk about physician assistants and nurses, like the comparison, what's the difference, which one is better. I'll give you my opinion, which I'm entitled to, on which one is best for you to choose if you want to, if you are considering the two. Okay, so first off, nurses are completely different from physician assistants. Even though we are all patient focused, all our work is to get the sick person back to health and move on with his or her life. Our work in caring for that patient is different. Nurses are advocates for patients, and their work is mostly to make the patient feel comfortable, even though they are sick, to feel comfortable. We provide basic care to them and nurse them. Like, it's just like how your mom will take care of you if you are sick, but the nurse is your mom with a medical knowledge, and so it's able to do more for you. The physician assistant, if we want to describe them, we have to take the assistant aspect out and focus on the physician. A physician is someone who practices medicine. So physicians or doctors focus more on diagnosis, where they try to discover what is causing your illness or what is making you sick, and that is the diagnosis. So during after their investigation, maybe after a lab or talking to you, they discover that, okay, you might be having malaria, you might be having typhoid. And after the diagnosis, they develop a treatment plan for you to make sure that you get back to health. So a physician assistant does exactly that, and that is that. But the fact that they are physician assistants doesn't mean that all they do is to assist the doctor. No. If there is a medical officer present, then the physician assistant reports to the medical officer in charge or present. So if you want to talk about definition, that's a PA and a nurse for you. Now let's look at some of their differences. The PA program here in Ghana is a degree program, so it's strictly degree. So you can apply directly as an SHS graduate. If you have a general science background, it's only for general science students. And for nursing, we have courses from certificate, diploma, degree level as entry programs. So you can start from any of the levels, and any program you did in SHS is accepted. I've already started speaking about it. A PA or a physician assistant, depending on their location, depending on where they are, their job differs accordingly. So if a PA in the health center or a PA in a lower facility will be the physician in charge, they will do the consultations, they'll make the diagnosis, they will order the treatment or plan the treatment of that patient. And aside the physician work itself, they also act as facility in charges at the lower level. So a PA at the sub-district is in charge of the sub-district facilities, chief zones, and health center. And yeah, so they have managerial and administrative training attached to their training also. And the nurse will focus on patient care. So when the medical team diagnoses and uh, gives the treatment guideline or gives the treatment that will be used to treat this patient, the nurse will carry out all those plans, make sure the patient gets their medication through drug administration, do their head to toe assessment, do their own diagnosis, because nurses, we have our own nursing diagnosis that will lead to a care plan that you develop to make sure you're nursing this patient well and back to health. We don't have a lot of options for PAs right now in Ghana. So far, there's only one advancement that I know of. So as a PA, you can go and do the graduate entry medical program, and become a medical doctor, and then you progress in the doctor or medical field, become a specialist or all of that. But as a PA, there is no clear-cut career path for you. But as a nurse, you can specialize in any of the specialties, be it eye, ear, nose, and throat, dental, perioperative, all a lot of specialties for you. And you can also progress to have your master's in nursing. You can have your PhD. You can become a nurse consultant. You can become a lot, plenty of opportunities. So that is where the upper hand is for nurses. And so because of that, one of the questions I got is, which one should you choose? I would say look at what you want in your career. What do you seek to achieve? Do you like, the doctor vibe, the diagnosing, treatment route, or you want to be a nurse and be at the patient side, or other cadres of nursing, whether public health, psychiatric nursing, or even midwifery? Look at that. It has to be based on what you want. But if you ask me, because of the career advancement aspect, I would say do the nursing. If you start as a nurse and you don't like the nursing job, you still have the opportunity to become a physician assistant anyway. Okay, so you can still become a physician assistant, or after your degree, you can do the graduate entry medical program and become a medical doctor. It's the same at recruitment. So if you don't know where to start from, if you don't know what you really want, I would say do the nursing. And when you feel like this thing is not for me, you can branch it to PA, or you can branch it to medicine. But a physician assistant cannot come and become a nurse. That link is not there. You can't become a nurse. You either go and do the graduate entry medical program and become a doctor, or you stay a physician assistant. You'll be stuck for now. For now in Ghana, the physician assistants don't have a clear-cut career path, so most of them feel stuck. Most of them are also enjoying themselves because they are sub-district heads, so they don't really care about going back to school and all of that. So look at it and see which one will best suit you. If you want more clarifications, if you want more discussion, one-on-one discussions on some of these things, you can book a call with me. The link is in the description box, and we will talk over Zoom. It's a Zoom meeting. It will be a Zoom meeting, so you have to install the Zoom app to be able to meet up with me. So I'll leave the link in the description box, and you can do just that. I hope this video was helpful. Like, share, subscribe if you've not done that yet, and I'll look forward to seeing you in my next one. Bye.